Today I would like to talk about process addictions and some common treatments that are used in therapy to help clients overcome these. There are several different types of process addictions, including sex addiction, internet addiction, gambling disorder, problematic online gaming, and exercise addiction, among many others. Many of these aren't considered a true diagnosis, but clients may still seek out help. There are 3 different types of common treatments that are used by therapists to assist these clients. They are cognitive behavioral therapy, dialectical behavioral therapy, and motivational interviewing. Cognitive behavioral therapy is a technique that focuses on changing the unwanted behaviors by working on changing a person's specific thought patterns. It is considered short-term and can last anywhere from 1 to 16 sessions. It helps to identify realistic thinking and stop negative thinking, as well as distinguish rational and irrational conclusions. It is very problem-specific and goal-oriented. According to Kathleen Davis, family nurse practitioner, distorted thinking leads to distress and problematic behaviors, whereas thinking realistically with less negativity allows individuals to respond to challenging life circumstances in an effective way. This is the overall idea of cognitive behavioral therapy. Dialectical behavioral therapy is a more specific form of CBT. It includes 5 function areas. The first function area is enhancing capabilities. You're going to assist the client in regulating emotions, paying attention to the experience in the moment, effectively navigating these experiences, and tolerating stress and surviving crisis. Many therapists also teach their patients how to use mindfulness. The second function is generalizing capabilities. Therapists provide homework to practice the skills that are learned in the sessions in the patient's daily life. It helps to ensure that therapy is actually successful. Function 3 is improving motivation and reducing the dysfunctional behavior. This is accomplished by individual therapy sessions. It gives the patients reports to fill out at each session to help them and the therapist prioritize the thoughts, emotions, and feelings that are interfering with their life the most. It uses a variety of commitment strategies as well to enhance motivation. Function 4 is enhancing and maintaining therapist capabilities and motivation. This focuses on providing support, validation, and maintaining motivation for the patient. The therapists who practice DBT generally meet once per week or every so often with each other to help problem solve effective ways to assist clients who are having specific challenges they are struggling to overcome. The last function is function 5, which is structuring the patient's environment. Therapists have the patient modify their environment to fit what they have learned in their therapy sessions. The therapist may even take an active role in the modification with the patient. The last is motivational interviewing. It's a therapy method in which the therapist assists in engaging motivation within the patient to elicit behavior changes. It's used in substance abuse treatment commonly. It's goal-oriented and client-centered. There are generally 5 steps to motivational interviewing. You are to establish a rapport with the client, assess readiness, assess their motivation, identify the problem, help them find solutions, and identify the next step and schedule their follow-up. You must also address ambivalence, which is denial or conflicting feelings about wanting to change their current situation. You also must be able to roll with resistance, understand your patient's perspective, and encourage them to talk and always remain respectful.